Having multiple sclerosis and planning my pregnancy was a really big thing and a really big factor that came into the whole process. So I had a really bad relapse a few years before we decided to try and have babies. And that relapse really was what put a back burner on us having children any sooner, because we were in that middle stage of needing to change medication, but the medication not being available right at that moment. So having to wait until it was available. It was a new drug. So it hadn't, not many people had been on it yet. I was one of the first people to begin the new treatment. So once I'd focused on getting well from the relapse and trying to recover from it, it was then the whole new thing of, well, how do I get pregnant being on this medication and then not having been many people had this treatment and then getting pregnant. So trying to navigate all of that information and trying to make the right decision as to when was the right time to conceive and try and have a baby was a really difficult time in trying to work through, you know, trying to get pregnant and when to get pregnant. So it was really beginning with getting myself better from my relapse and then speaking with my medical team, which was my GP, my obstetrician, and my neurologist. So it was definitely a 2-year process, because it took, getting well first. Then obviously anyone who gets pregnant, wants to go through making sure that all of your vitamin levels are at the right levels, so that you're in, I guess, the best shape you can be before trying to conceive. So it took about 2 years of really getting better and then healing from the relapse, and trying to get my head around accepting the unknowns of making sure that, well, I could never make sure that everything was going to be okay, but at least in my head, make sure that everything was going to be okay, that, I'd done my due diligence in terms of trying to get myself better, get on all the vitamins that I needed to get onto, and then, speaking with all of my doctors to make sure that, when was the right time to either get off medication and then start trying and things like that. So definitely with the first, it was very scary getting off medication. So on the treatment that I was on, you had to be off the medication for a certain amount of time before trying to conceive. So that was really scary. It was the first time I'd ever really been off medication for that long. And then there was the whole stress of, you have to be off medication, but then you're also not sure how long it was going to take to conceive. And my obstetrician was saying, it can take anywhere from 6 months to a year. But then my neurologist was, on the other hand, was saying, if you're not pregnant within the first 3 months, we're going to have to relook at, your treatment or what we're going to need to do next. So there's just so many unknowns going through that you really try and keep yourself balanced and not anxious, but it's really difficult. It's just a difficult time. There's lots going through your head. There are a lot of things to consider, but I felt like making sure that I was speaking with the right people was really important, and then making sure I'd done everything I can, so that everything that was in my control, if I had done that, then it was the one thing that was making me feel a little bit less apprehensive about what was to come. And then I really found that just talking to people in real life scenarios who'd been through it was really helpful, because although everyone and their MS diagnosis is so unique and everyone is different, it's just really good to have those conversations and have those chats. I guess just to give you a little bit of comfort in someone else's journey, to know that, there may have been, trips along the way, but you got there in the end and it was okay.